Have you ever wondered why some diseases remain hidden in the shadows, quietly affecting people without anyone noticing? Scrofula is one of those conditions often overlooked, yet it holds a significant place in the world of health, particularly for those who might be at risk. Imagine a swollen neck, tender to the touch, perhaps a lingering fever, and yet the cause remains a mystery. This is the reality for many affected by scrofula, a form of tuberculosis, TB, that doesn't just stay in the lungs but can spread through the body, especially to the lymph nodes in the neck. Scrofula, often called the king's evil, is steeped in history and carries a weight of stigma and misunderstanding. In the past, it was believed that members of the British royal family could cure this condition with a mere touch. Today, however, we understand that it is not a royal ailment but a serious bacterial infection that affects individuals, particularly those with weakened immune systems. What is scrofula? Scrofula is a form of extrapulmonary tuberculosis, which means the tuberculosis bacteria, specifically Mycobacterium tuberculosis, is affecting parts of the body outside of the lungs. The most common manifestation is swelling of the lymph nodes in the neck, often leading to discomfort and a visible bulge. This condition can last for weeks or even months and is typically painless, which can make it easy to ignore until it becomes severe. Symptoms of scrofula. The symptoms of scrofula can be alarming, yet they often develop slowly and without much pain. The primary sign is the presence of one or more swollen lymph nodes on one side of the neck, which may grow to sizes ranging from 3 centimeters to 10 centimeters. Here's a closer look at what you might experience. Swelling, a noticeable lump on one side of the neck. Fever and night sweats, these systemic symptoms can accompany the localized swelling. Weight loss, unintentional weight loss can occur as the body fights the infection. Fatigue, a general feeling of tiredness can persist. Possible ulceration, in advanced cases, the swollen area may break open, draining fluid, and becoming vulnerable to other infections. How does scrofula develop? The Mycobacterium tuberculosis bacteria are most commonly spread through the air when an infected person coughs or sneezes. However, in cases of scrofula, the bacteria can enter the body through contaminated water or environmental exposure. Once inside, these bacteria travel through the bloodstream to the lymph nodes, leading to the swelling characteristic of this condition. Interestingly, the incidence of scrofula can vary greatly between different parts of the world. In the United States, there were approximately 7,882 reported TB cases in 2021, with scrofula accounting for about 20% of those cases. This condition is notably more prevalent among women and individuals aged 30-40 years. The importance of diagnosis. Diagnosing scrofula can be quite challenging. Because it mimics other conditions, doctors must rely on a combination of physical examinations, imaging tests, and lab analyses to reach a conclusion. A fine needle aspiration may be performed, where a thin needle is inserted into the swollen lymph node to collect fluid for testing. This helps to identify the presence of mycobacteria. Additionally, imaging tests like X-rays or ultrasounds might be utilized to check for signs of TB in other areas of the body. A tuberculin skin test can also be administered to determine if there has been any prior exposure to TB. Treatment options for scrofula. If you or someone you know is diagnosed with scrofula, it's essential to understand that the treatment process is lengthy and requires commitment. The standard treatment includes a multi-drug regimen over several months. Here's what you can expect. Initial phase, first 2 months. Isoniazid, rifampicin, ethambutol, pyrazinamide. Continuation phase, next 4 months. Rifampicin, isoniazid. While medication is the cornerstone of treatment, surgery may be considered in some cases to remove affected lymph nodes, particularly if the medications do not yield results. However, Surgery is not always effective and can lead to complications such as recurrent infections or deeper wounds. Preventing scrofula. Prevention is critical when it comes to scrofula and other forms of TB. Here are some strategies to minimize the risk. Limit close contact. Stay away from individuals known to have TB, especially in areas with high TB prevalence. Vaccination. The Bacille Comet Garin, BCG, vaccine offers some protection against TB but is not routinely recommended in the United States. Be aware of your environment. Drinking clean water and avoiding contaminated sources can help reduce exposure to the bacteria that cause scrofula. The bigger picture, living with scrofula. For those diagnosed with scrofula, it's essential to stay informed and proactive about your health. Scrofula can lead to complications, especially if left untreated. It can spread beyond the neck and form open wounds, creating a pathway for other infections. Moreover, the recovery rate is high, especially for scrofula caused by Mycobacterium tuberculosis, with up to 100% recovery post-treatment. However, for scrofula caused by non-tuberculous Mycobacterium, recovery rates drop to around 90%, especially following surgical intervention. Final thoughts. Understanding scrofula is not just about recognizing symptoms, it's about raising awareness and reducing stigma surrounding this hidden form of tuberculosis. It reminds us that diseases can take many forms, often hiding in plain sight, and affecting vulnerable populations disproportionately. We must advocate for better education and resources for those at risk, ensuring that they can recognize symptoms early and seek help. Scrofula might not be a common topic at the dinner table, but it deserves our attention and compassion. Remember, knowledge is power, and being informed is the first step in preventing this condition from affecting our communities. Stay vigilant, seek information, and spread awareness because together, we can tackle even the most hidden health challenges.